Senator Susan Collins.
So obviously, we don't need to introduce Senator Collins because we all know her. She's been here forever and very much a champion for so long, which started, as I know, from a home visit. And that is so critical that we make sure that we have our representatives and Congress folks go out on visits. Home care and hospice has been a passion for her. She perseveres to defend home care and hospice. She has sought to put home and community-based care at the very heart of our healthcare system. She is the chair of the Senate Aging Committee, a critical position for our elders, and serves on the Health, Education, Labor, and Pensions Committee, as well as the Primary Health and Retirement Security Subcommittee. She founded the Senate Diabetes Caucus and led the effort to more than double the federal funding for diabetes research. Senator Collins sponsored the Home Health Care Access Protection Act to reform the process of evaluating home health case mix changes, legislation to extend the rural add-on, and the Home Health Care Planning Improvement Act, which would allow nurse practitioners, advanced practice nurses, and physician assistants to sign home health plans of care. Her hometown paper, Foster's Daily Democrat, wrote, "Mainers should be proud of her work on behalf of her state and nation, and we couldn't be more proud of you." So please, let's give a warm welcome to our senator from Maine, home care and hospice hero, Senator Susan Collins.
Thank you so much. Thank you for such a warm welcome. Thank you. Thank you so much. Thank you so much for such a warm and enthusiastic welcome. Julie, I don't know where she's gone now. There she is. Julie may be small in stature, but she is a giant in home health care delivery in the state of Maine, and we're delighted to have her here. So this is my 17th year addressing you. And it is indeed because the issues affecting home care and hospice care have always been at the top of my agenda, and they always will be. It has been such a pleasure to work with my friends from Maine at the Maine Home Care and Hospice Alliance, as well as with my dear friend Val, who does such a terrific job, and the staff at NAC, and on a whole variety of issues to modernize and promote fairness in the Medicare home health and hospice benefits reimbursement. As the chairman of the Senate Aging Committee, I'm all too aware of the challenges facing our nation's healthcare system, which are driven by demographics. Our healthcare system now stands directly in the path of a tidal wave of aging baby boomers like myself, who will be retiring at the rate of 10,000 a day for the next 20 years. If you think about it, if you look at the demographics, the part of our population that is growing fastest is what's called the oldest old. It's those who are 85 and older. Our systems clearly need to adapt and change if they are to be responsive to that tidal wave. One of the most important things that we can do is to shift our orientation and our reimbursement system from institutional to community and home-based care. Advances in technology and medical practice have made it possible for our older adults who previously would have been forced to move to a hospital or a nursing home to stay, in so many cases, just where they want to be, in the privacy, security, and comfort of their own homes. And that is why I'm so concerned that Medicare beneficiaries continue to face completely unnecessary barriers in accessing needed home health care services. To ensure that our Medicare patients get the home care they need when they need it, I have introduced the Home Health Care Planning Improvement Act to allow our advanced practice nurses and our physician assistants to order home health care for their Medicare patients. If you think about it, it's only logical. These healthcare professionals are playing increasingly important roles in the delivery of healthcare services, particularly in rural and medically underserved areas of our countries where physicians may be in short supply. Medicare already pays them to provide physician services that are within their scope of practice. They can also certify that Medicare patients are eligible for skilled nursing services. So why in the world aren't they allowed to order less costly home care services for their patients? It's one of those rules in Washington that defies common sense. We have a few others in case you haven't noticed. At best, this requirement adds paperwork and a number of unnecessary steps to the process before medically necessary home health care can be provided. At worst, it leads to needless delays in getting our seniors and disabled citizens the home health care that they need, simply because a physician may not be available to sign the form. I've also introduced a bill to extend the modest increase in payments for home health care services in rural areas that otherwise will expire on January 1st of next year. Surveys We know that surveys have shown that the delivery of home health service in rural America can be as much as 12 to 15% more costly, simply because of the extra travel time required to cover the long distances between patients, the higher transportation expenses, and other factors. You've only to look at my home county in northern Maine, Aroostook County, which is bigger than Rhode Island and Connecticut put together, to realize the long distances that home health nurses frequently have to travel. For example, home health agencies in Aroostook cover almost 6,700 square miles, with an average population of fewer than 11 persons per square mile. Now, these individuals still need the same kind of care. That's the point. So we need to be able to adjust for that. It's also important to realize how important those visits are in rural America, where they may be the only healthcare professional who sees that patient over an extended period of time and can spot changes or declines in their condition. If the extra 3% rural payment is not extended, my fear is that many of these agencies will be forced to either turn away rural patients with greater care needs or even close their doors altogether. My friends, we cannot allow that to happen. Again, I want to thank you for all that you do on the front lines. And today in Washington, you also have an important mission. Go to your members' offices in both the House and the Senate and tell them you need them to co-sponsor the rural add-on bill and my bill to allow advanced practice nurses and PAs to prescribe home care. It's only right, it matters to their constituents, and if you tell them the impact on the people you help care for, some of the most vulnerable people in this nation, I can assure you we will pick up co-sponsors, we will gain momentum, and we will get the job done. Thank you so much. Thank you.